my name is Haley. I will be your LPN student for today. So today we're going to be doing a head-to-toe assessment, just checking for any abnormalities in the body. Do you have any questions? No? Okay. First I'll have you verify your name and date of birth. Okay, that matches up. Now I'm going to check your chart. Okay, it matches on your chart. So can I have you rate your pain on a scale of 0 to 10, 0 being no pain and 10 being the worst? A 0? Okay. Before we start, I have a couple questions. So do you have a history of falls? No? Okay. Do you have any thoughts of harming yourselves or others? Okay. And do you feel safe at home? Okay. And then can you name who you are, where you are, and what day it is? Okay. Patient is cognitive. Their speech pattern is good. I don't see any signs of abuse, nothing like that. Their hygiene and odor are good. So first we're going to start with the head. So the skull shape is normal, it's round. There's no hair loss, nothing like that. Everything looks normal. The skin is warm, dry, and intact. So I'm going to start with your eyes. So can you follow my finger? Okay, the eyes are bilateral. Now I'm going to assess pupil size. Okay, pupil size is good. Now I'm going to look at the conjunctiva and the scleria. Okay, looks good, nothing abnormal there. Have you had any problems with vision? Okay, and have you had any problems with hearing? Okay, I'm going to assess the ears, so I'm going to pull up and back and look inside. Okay, the ears look normal, no signs of infection, and then the outer ear canal also looks normal. Now I'm going to look at your sinuses and inside the nose. So inside the nose, looks good. Now I'm going to feel your sinuses. Is it okay if I touch you today? Okay. Does this hurt at all? No? Okay, I'm going to feel up here. Does that hurt? Okay. Now I'm going to look inside the mouth. So it looks good. The mucosa looks good. The teeth are intact and the tongue looks normal. No abnormalities there. Now I'm going to feel the neck for masses. Okay, the neck feels normal skin masses. Now I'm going to look right here for hydration. Okay, and the skin looks good, it bounces back. Now I'm going to assess the armpits. So I'm just going to look right under here. Okay, the armpits look good, no abnormalities there. Now I'm going to assess your chest. So I'm just going to pull this down. The chest looks normal. The skin is warm, dry, and intact. The breasts are symmetrical, no abnormalities with the nipples. Everything there looks good. Now I'm going to listen to your lung sounds. Okay. I'm going to start at the top of the breast and then move to the other side. And then below. And then to the sides. And again, the chest looks normal, the skin looks normal, no abnormalities there. So I'm going to flip you over and assess the back. So the back skin looks normal, it's warm, dry, and intact, no abnormalities at the back or the posterior. So now I'm going to assess your lung sounds on the posterior. Okay, normal, 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 and then the sides. Normal, normal. Okay, I'm gonna flip you back over. Now I'm going to look at your abdomen. So I'm just gonna pull this up a little. And the abdomen looks normal. The umbilical is centered and symmetric, no abnormalities there. The skin is warm, dry, and intact. So I'm going to start on the lower right quadrant and then move to the top and then the upper left and then the bottom left. Okay, the bowel sounds sound good. Have you had any problems with bowel movement in the last couple days? Any changes in your stool, anything like that? No? Okay, now I'm going to palpate. So does this hurt at all? No? Does this? Does this? Does this? Okay, good. Yep, and the skin looks normal. No scratches, bruising, nothing like that. Warm, dry, and intact. Now I'm going to assess your arms. So I already looked in the armpit, so now I'm going to assess the arm skin. I don't see any signs of edema. The skin is warm, dry, and intact. I'm going to assess the pulse bilaterally. Okay, the pulse is good, it matches up. Now I'm going to assess capillary refill. Okay, capillary refill is good. And then your range of motion. Have you pushed down my arms? Okay, range of motion is good. I'm just going to cover you up a little. Now I'm going to assess your lower extremities, so your legs. I'm going to pull this up. And have you, how often do you urinate? Have you had any problems with that? Any changes recently? No? Okay. And if it was indicated, we would do an assessment on the urinary area and the anal area, but if not indicated, we don't do that. So I'm assessing the leg skin now. It's warm, dry, and intact. All the skin is suitable for a race. No cuts, bruises, nothing like that. No edema. Now I'm going to assess pulse. Okay, the pulse is good. And then range of motion. Push down on my hands. Okay, good. And then I'm going to assess capillary refill for 3 seconds. Good. Okay, I'm going to cover you back up. Well, that concludes our head to toe assessment. Do you have any questions for me? No? Okay. I'm going to make sure the bed is locked. Good. I'm going to make sure your call light is in reach of you. I'm going to document on EHR. Okay, I'm going to wipe down my equipment with a wipe. Good. And then I'm going to sanitize my hands and exit the room, maintaining privacy.